So I'm going to do this video on hypertrophy and enlargement because some douchebag truck driver decided to drive in the background on the last video. So we're just going over the difference between enlargement and hypertrophy and how you can diagnose them on an EKG. Because an EKG just shows the mechanical efficiency of the heart. The electrical efficiency of the heart. It doesn't show anything mechanical about how the heart's working, how strong the heart is, etc. All it shows is how well the electrical signal is moving through the chambers of the heart. Now, luckily, it seems that a lot of conditions of the heart have altered electrical signals, and through years of study and whatnot, we can determine what signal leads to what condition. Like a heart attack has a certain signal, enlargement has a certain signal, blah, blah, blah. So the two big ones are hypertrophy and enlargement. Hypertrophy and enlargement. Holy crap. Okay, so hypertrophy and enlargement. Now, the heart can do both of these. Now, hypertrophy is when a muscle gets bigger. So the easiest way to think about that is think of your biceps. If you're doing a bicep curl or whatever, the point of working out is to make your muscles bigger, to get the muscle bigger. Well, since the heart's a muscle, it can do the same exact thing. Whereas in your biceps, your back, whatever, any other case, a muscle hypertrophying is good. That's what you want. But with the heart, you don't want the muscle to get bigger. Reason being because the muscles of the heart, okay, so we'll draw our heart. What happens is the walls get bigger. And if the walls are bigger, that means there's less room for blood. So we'll draw a picture for that. So here's the heart. It's mostly the ventricles because that's what we care about. You have your left ventricle fills up with blood. Say in a normal healthy heart, it fills up with blood. Say it fills up 90% full of blood because it's never going to fill up. Might fill 100% full of blood, whatever. And say it ejects like 90% of that. It'll never eject all of it, but let's say in a perfect world, it ejects all 90%. Now, say after the heart hypertrophies, so what happens is the walls get bigger. So these are the walls, the box. The walls will get bigger. So this is what would happen. The wall gets bigger, and thus also the wall gets stronger, but the wall gets bigger. If the wall is bigger, that means there's less room for possible blood to enter. So now you can only hold, say, 80% blood, less blood. So that's what happens when the heart hypertrophies. Yes, the wall gets stronger, but it can ultimately hold less blood, so that's not technically good. Now, this hypertrophy happens because of a pressure overload. And instead of just memorizing pressure overload, you can start thinking, well, when you work out in the gym, if you're doing a bicep curl, a chest press, whatever, you have a certain pressure on your muscles, right? And you're lifting the resistance of that pressure. So you're lifting the resistance. Well, that resistance creates a pressure on the muscle, and the muscle adapts and gets stronger to overcome that pressure next time. Same thing what happens with the heart. Overcomes a certain pressure, in this case blood pressure. It's mostly high blood pressure which causes this. It's overcoming blood pressure over a period of time, and it adapts to overcome that high blood pressure, and thus the walls get bigger. So it's pressure overload. Now, enlargement will be from a volume overload. Now, you can tell just by the name, it means the chamber actually enlarges, it gets bigger. And it's mostly the atrium that enlarges. So the chamber, the wall actually gets bigger like this. Now, that's not technically good. It's true it can hold more blood because it gets bigger, but there's a video on the Frank Starling mechanism that I made that shows that the more the heart fills with blood, the more it stretches, and the more it stretches, the harder it contracts. So it's good for contractility, which is good. But there's a certain point where if you stretch it too much, it's like an old rubber band. If you stretch it too much and it's old, it lost its elasticity. There's nothing you can really do to fix that. It's the same thing with the heart. Once it stretches past a certain point, it's no longer as elastic, and that means the contractions are weaker. If the contractions are weaker, then the stroke volume's lower. If the stroke volume's lower, the cardiac output's lower, and it's just chain reaction. Now, an EKG can't really tell exactly what chambers hypertrophy and enlarge, but it's been shown over years that the ventricles most likely are most hypertrophy, and the atrium mostly enlarge. That's just how it is. So on EKG, we look for ventricular hypertrophy or atrial enlargement, one or the other. Now, luckily, each one has different signs that we can look for on an EKG, and that's what we're looking at right now. So we'll get our normal 12-lead EKG. So for atrial enlargement, we'll just put it, atrial enlargement. Atrial enlargement. Now remember, there's two atrium. There's a left atrium and a right atrium. So we'll just say left, right. Now, you're trying to diagnose which one is a large, the left one or the right one. Each of them have different criteria. Now, whenever you're looking for atrial enlargement or enlargement, there's three things you want to look for. You want to look for an increase in amplitude, and that's the height of the wave. So like this has more amplitude than this because it has higher height. And also an increase in duration, how long it takes. So like this, so it would be vertical versus horizontal. This will be horizontal, this will be vertical. And there's also the axis deviation, but that's not really too important. That's the third criteria. Now, what would you look for? The increase in amplitude or increase in duration? Now, remember, there's a left atrium and right atrium. You're trying to diagnose which one has what. So it seems that for the right, you look for something specific, and for the left, you look for something specific. Now, for the right, you look for an increase in amplitude. And then for the left, you look for duration increase. Reason being because if you take a P wave, you have your P wave right here. If you remember, it splits right down the middle to the right and then the left. So the right contracts first and then the left contracts. Now, if you were to look at increase in duration, you couldn't tell if that was because the right atrium is enlarged or it's because the left atrium, because the left signifies the end, if that makes sense. So for right atrial enlargement, you just really look at increase in amplitude, how high the height is. Normal height is 2.5 millivolts or 2.5 little boxes. So in this instance, this is a good EKG. This atrium is good, but you will look over here, you will look at this part of the EKG, and it'll be higher than 2.5 boxes or 2.5 boxes. If it's higher than 2.5 boxes, you put right atrial enlargement on it. Now for left atrial enlargement, you look at the duration. So yeah, you can look at the left side of it, or you can just look at the whole duration. If the left side is longer than 0.04 seconds, I didn't really go over like what the boxes mean, but 0.04 seconds is one little box. So if you zoom in on this, each little box is 0.04 seconds. So 0.04, 0.08. So one big box is 2 seconds, just by doing math. And each little box going up is 1 millivolt. So going up all together is 5 millivolts. I'm sorry, 1 millivolt going up. So, and this is, you can also calculate the heart rate that way, but we'll go over that later. But this is how you diagnose atrial enlargements. You will look at the duration and the amplitude. Amplitude to get right atrial enlargement, duration to get left atrial enlargement. And the best lead to look at is lead 2, because lead 2 shows the best look at the P wave, because you have the strongest impulse. So that'll be like this, 12 lead EKG. This will be the best one because it's beautiful and everything. You have a perfect P wave, all that stuff. You wouldn't look here because this one doesn't really have a P wave. But like in this one, it will always be a negative deflection because it's going away from the heart. That's in another video, but you want to look at it. You always want to look at lead 2 because it's the best representation. Now for ventricular hypertrophy. Ventricular hypertrophy is a little different than enlargement. Now, over time, hypertrophy happens because of pressure overload. The heart gets bigger, stronger, but also the chamber gets smaller. Now, if the heart gets bigger and stronger, it means it has a stronger pulse, or contraction every time it contracts. So this would be really, really large R wave. This isn't quite large hypertrophy, but it'll be a very large R wave like this. Now, again, just like the atrium, there's a left and a right. The left is what we really care about because that's the one pumping blood throughout the whole body. But to diagnose the right atrial, first we'll go to the right ventricle. To diagnose right ventricular hypertrophy, you will look for something called the transition zone. Now, in another video, I'll go over how to find transition zone and pretty much how walking through like an actual test, what you would have to do. But a transition zone means you look at V1 to V6, so you look over here. And the way these precoral leads are orientated, R waves want to start small and progressively get bigger and bigger and bigger because each one's getting closer and closer to the left ventricle. So this will record a larger R wave as it gets closer to the left ventricle. And the S wave starts big and gets smaller. Now if you look here, that's what's happening. You have a small R wave, a little bit bigger, huge, and whatnot. And the S wave is kind of doing something funky. Normally this wouldn't happen. It will start big, it wouldn't start small, get big. And then right ventricular hypertrophy, R wave progression will be backwards. It would start with a large R wave. The R wave will get smaller as it goes on, which that's not normal. Now for left ventricular hypertrophy, there's a few criteria. It's kind of like the risk factors for cardiovascular disease. The more criteria you have, the more likely. No. The more criteria you have, the more likely you have left ventricular hypertrophy. Now, there's different criteria you have to memorize. I'm not going to list all of them, but they're mostly like if the R wave in one of these leads, like in V6, plus the S wave here is a certain height, it's criteria. If another R wave plus is a certain height, bigger than another R wave, is whatever. So it's all different criteria you have to memorize. So those are hypertrophy and enlargement.